Welcome to the UbiSim Obstetrics Orientation, where you will practice caring for our patient Amy. Take your time as you go through the orientation so you can familiarize yourself with the equipment and features you will use during a UbiSim Obstetrics scenario. To start, first review the patient information in the electronic health record. Here you will see examples of the patient profile, provider orders, and lab results. When you are ready, press on the Next button on the floating window on the left of the electronic health record. Perfect. Next, perform hand hygiene. The hand sanitizer is located on top of the cart. Press down on the dispenser to put the sanitizer in your hand. When you are ready, press on the Next button. OK. Confirm the patient's identification by looking at the ID band on her left wrist. There you will see the patient's name, date of birth, and allergy information. Well done. The patient is on seizure precautions and will need seizure pads applied to the bedside rails. First, grab the rail handle and lift to raise it. Then grab the black seizure pad from the cart next to the IV pump. Drop the pad on top of one of the side rails. Doing so will put the seizure pads on all of the bedside rails. Please note, the seizure pads cannot be removed from the side rails once they are applied. Great. Now it is time to teleport to the side of the bed by the patient monitor. To do so, aim the thumbstick towards your desired location. A column will appear. Aim at the column, release the thumbstick and you will be teleported to your new location. Well, perfect. Notice how the monitor above the bed now displays the fetal heart rate, variability, pattern, and uterine activity. You may use the toggle feature at the bottom of the fetal monitor to review the strip history. Pressing the Live button will return you to the live view of the strip. OK. Next, you will palpate the fundus. Look down at the palm of your hands and choose the hand gesture appropriate for palpating the fundus. Then palpate the highlighted fundus area. You will see a text box appear with the fundus assessment findings. When a contraction occurs, you will see information about the intensity here. You will feel haptic feedback through the controllers for the duration of the contraction. Great. Now teleport back to the other side of the bed by the cart. Remember, aim with the thumbstick and release. Well done. Now you will measure the fundal height. Press the assessment tab on the supply cart and pick up the measuring tape that appears on top of the cart. Place the measuring tape on the highlighted area over the patient's pubic bone to measure the fundal height. When you are done, place the patient's gown back on by releasing it on top of the patient. Perfect. Next you will assess the patient's deep tendon reflexes. Start by grabbing the reflex hammer on the top of the supply cart. You will see highlighted icons near each reflex site. Place your other hand on each icon to see the name of the reflexes that you can assess. When you're ready, grab the patient's body part where each icon is placed. The patient will automatically reposition in the area where you can tap your reflex hammer will highlight. Text will appear to show you the grade of each reflex. Perfect. Now it is time to perform the ankle clonus test. Teleport to the side of the bed opposite from the supply cart so you have adequate room. When ready, grab the highlighted area on the patient's knee to stabilize the leg. Then dorsiflex the patient's foot. You will see a text pop up with the assessment findings of the ankle clonus test.